y-axis is blood glucose, and over there I've got then the color showing the ideal blood sugar, the ideal amount of glucose in the bloodstream at any given time is somewhere between 70 and 90. This would be a fasting value. All of these numbers here are fasting. And then there's a gap, and we actually start to say something's amiss when we get to 110 to 125. This is considered pre-diabetes. So this is when we know that the blood sugar is out of the ideal range, but it's not actually diabetes yet. And then when it is 126 and above, in other words, greater than 125, it is considered to be type 2 diabetes. Again, these are all fasting numbers. So you can see a relationship here. I don't know if my pointer will show on the screen. Yes, it does. So what's going on is excess energy is being stored. And let me just show you a little line. So here's this line, the white line that I've drawn, is basically showing over time. So in our early years, up through somewhere in our 20s probably, our energy storage is typically quite good. Of course, sometimes what's happening is we're finding out that obesity and overweight is occurring at younger and younger ages. So I didn't put years on this chart because it will vary from person to person. But what happens typically is we start off with a slight increase, and then at some point in time, we start having a steeper rate of storage. We're storing more calories per year or per day, whatever, per unit of time, and that's why the line is going up a little steeper here. And then it levels off for most of us at some point where we start trying to really control our weight more. Well, what this is doing is it's causing insulin resistance, and that's why our blood sugar is going up. So let's look at this next couple of points. So the excess energy that we're consuming and not able to use causes lipotoxicity in the organs. In particular, this leads to insulin resistance. So we end up storing calories in places that were not designed or intended to have storage. Adipose cells are the things that we have to store energy. But once they are resistant or insufficient to contain, then our body will start to put adipose tissue or fat in other tissues, or muscle tissue, liver, organ tissue, pancreas, etc. So when that happens, then we have what we call insulin resistance. And that means the insulin that our body is producing is not accomplishing the task that it used to produce, okay? Doesn't have the same effect. And so then the next line here, the pancreas then produces more insulin to compensate, to control the blood sugar. Because the thing that the body is seeking to do is to keep the glucose in the bloodstream at that ideal range, somewhere between 70 and 90. Well, then over time, if this continues long enough, the pancreas actually will fatigue or tire, if you will. And in some extremely bad cases, it actually will become permanently impaired. But the good news is that it takes quite a while for that to occur. It is fatigued and it's not as productive, but it's not dead yet. And so, but anyway, so the pancreas fatigues, the insulin then levels drop because it cannot do what it's been doing for so long. When the insulin levels drop, then the glucose cannot be kept down where it wants, so it starts to climb. And then we say, oh my, you've got pre-diabetes. Or if it continues on, oh, you've got diabetes. And of course, the interesting thing about this is that many, many people in the world have pre-diabetes or even diabetes and don't know this, because until the diabetes blood sugar numbers rise high enough, there are essentially no real symptoms. I mean, people drink more water than usual, but that's not a very alarming thing. They may have to urinate more than usual, but it's amazing how easy it is to ignore some of these things. And sometimes diabetes is not discovered until it's quite advanced and the blood sugars are quite high. And of course, if they get high enough, it can be problematic. You can have diabetic ketosis. Okay, so this little overview, I'm going to, let me just see here. Yeah, I've already talked about that. Oh, I just want to say this one thing that's added here. There are many factors that contribute to what is meant by too much energy. There's a lot of amazing amount of dialogue and controversy in some circles about this, and there are certainly some very intelligent people who make a major point saying it's an oversimplification to talk about energy in and energy out. And I won't disagree with that. It is a simplification, but it isn't incorrect. Because the bottom line is when our energy continues to be added to our stores, when I'm living a lifestyle, or anyone else is living a lifestyle where I continue to store more and more energy, that's too much energy in, okay? So there's, it turns out that the bacteria, the microbacteria in our GI tract have a major impact on how we metabolize calories. And so as somebody eating, 50% more calories than another person, and they're not gaining weight. Well, so they're not having, all right, if they're not gaining weight, then that's not too much energy for them, but it might be way too much for me. And so I just wanted to clarify that one. I'm not making or suggesting that there's an exact or precise amount of calories that everybody should consume if they want to be healthy. It varies greatly, and there's a lot of factors that go into it. But nonetheless, the key point is, and this is sustained by the evidence, that when any individual is putting on excess weight over time, there's too much energy being consumed. All right, what I want to do now is I want to play some of this information from the Complete Health Improvement Program, PIVIO, and we'll come back to the slides here after that. All right, let me get the sound ready. Okay.
Here's the question. What is most closely related to the development of diabetes? Are you ready to go with me to Colorado and take a look? Let me take you there to the St. Louis Valley study. Here, researchers tracked 134 people for 3 years who were not diabetics yet, but they were on their way. They were pre-diabetics. Their question was, what drives these pre-diabetic people to become full-blown diabetics? Is it the amount of sugar and carbohydrates that most people are worried about, or is it something else? Here's what the researchers found. They found that a daily 40-gram increase in fat, that's about the amount of fat in a bag of potato chips, increased the risk of becoming diabetic by 6 times. So fat may play a role here, doesn't it? They proposed then that fat may be a major player. They believe that it alters cell membranes, which in turn may affect the signal transduction across those membranes, and thus decreasing insulin sensitivity. Could it be the fat gumming up the cellular keyholes? Or could it be the calorie overload, where fat, of course, plays a major role as the most calorie-dense nutrient? Let's go to Harvard and see if they can help us. Here, the famous Nurses' Health Study found over a period of 16 years, 3,300 new cases of diabetes out of a pool of 85,000 nurses. They analyzed the data and they found that 91% of these new cases were directly attributable to lifestyle choices. It wasn't so much genetics, it was 91% lifestyle issues. Diabetes then was not so much a disease of genetics as it was a disease of lifestyle choices. And among those lifestyle choices, nothing was more powerful than the amount of overweight. Listen to this. Comparing those at the highest weight with those at the lowest weight yielded a 40-fold relative risk differential. Did you get that one? 40-fold, 40 times more diabetes at the upper end when compared to the lower end. Weight, overweight. Well, let's see what we can learn from the famous diabetes prevention program called the Dpp Study. Here they explored the questions of drugs, in this case metformin, or lifestyle. They took 3,000 some obese pre-diabetics at 27 centers, divided them into 3 treatment groups, and tracked them for 3 years to watch for the clinical outcomes. Which group would have the most diabetics? Group 1 was a control group receiving placebo, was the dummy dose. Group 2 received the drug metformin, and group 3 received intensive lifestyle intervention with the goal of losing 7% of excess weight and to walking 150 minutes a week. And here you see the outcomes over the 3-year period. You see the 3 groups. Group number 1, placebo. 29% of these pre-diabetics turned over the next 3 years into diabetics. That's 29%. Then group number 2 on medication, you would expect fewer diabetics now, right? And that's exactly what happened. Only 22% of these people turned into diabetics. And then group number 3, the intense lifestyle program, here only 14% of the pre-diabetics became diabetics, which means it was a 58% greater benefit than those who did not use any medications and were on the placebo. This finding has also been validated by the recent report from the Adventist Health Study. This study has been tracking some 60,000 people in North America in this particular study, where some were strict vegetarians and others were meat eaters. Here's what they found. They found that the meat eaters carried considerably more weight, and they also had 250% more diabetes. A most compelling question then would be, what is causing the diabetes? Well, actually, 3 diet and diabetes studies at Harvard have been tracking 200,000 people for a decade. And what did they find? They found that the daily use of 4 ounces of unprocessed red meat, that's steak and pork or hamburgers, increased the diabetes risk by 20%. They also found that the daily use of only 2 ounces, that's about 60 grams of processed red meat like bacon, hot dogs, or sausages, increased the diabetes risk by 50%. But when they replaced 1 daily serving of those processed meat with a whole grain dish, the diabetes risk dropped by up to 35%. Think of it. Just imagine replacing some processed meat with some whole grain dish, 35% drop in the risk of diabetes. Amazing, isn't it? What could make the difference? The Harvard researchers proposed 3 possible mechanisms for the greater diabetes risk. They suggested, number 1, it could be related to the weight gain. Number 2, it could be the toxic effect of the nitrosamines on the insulin-producing pancreatic cells. And number 3, it could be the oxidative stress and inflammation related to the kind of iron in meat and the way it is prepared. Now, to summarize, diabetes has increased and reached epidemic proportions. Its clinical and cost consequences are devastating, but we can do something about it. Diabetes is not inevitable. It doesn't have to be the death sentence that people fear. Many studies, after all, now suggest that a lifestyle change can help us to prevent diabetes. What we need to do is move away from energy-dense foods high in fat and sugar and low in fiber, and to move towards a more natural diet, more whole foods, more plant foods, low in fat and high in fiber.
I have seen and cared for many patients with diabetes over the years, and based on that experience, I'd like to share some insights with you in regards to living with this condition. Often, getting the diagnosis of diabetes can be overwhelming, especially for younger patients below the age of 30, but for older patients as well. In many cases, the reaction is one of denial or avoidance. Try and accept that you have the condition so that you can deal with it effectively. I have had patients admit to me that they have experienced not only denial, but crying spells, anger, resentment, and sadness. However, it's best to acknowledge and accept the reality in order to address it. Next, knowledge is power. It's really crucial that you educate yourself about diabetes by reading about it, attending diabetic teaching classes, and asking questions. Make sure you read from credible sources because much of the information on the internet is blog and opinion. Also invaluable is to talk to individuals who have gone through the same experience and are living successfully with this condition. The more you learn, the better equipped you'll be to take action. As the saying goes, the best defense is a good offense. Next, when blood sugars are high, some individuals have no symptoms, even when blood sugars are as high as 300 or 400. But usually symptoms do occur, and they include frequent urination, feeling thirsty, increased appetite, blurred vision, and feeling tired. Now, these symptoms usually go away once the blood sugars improve. Also, if you're on medicines, especially insulin, please check your blood sugars at least once a day. If blood sugars are in very poor control, you may need to check them up to 4 times a day, before meals and at bedtime, until the blood sugars get under better control. Always write the results down in a logbook for the benefit of you and your doctor. Now, medicines can be stopped at times, but should always be done in partnership with your doctor. Stopping medicines must be replaced by consistent lifestyle habits. In other words, something has to give. It's best to adjust your medicines after the blood sugars come down. Also, you can get instructions from your doctor beforehand on just how to change your medicines based on the blood sugar levels. If you have diabetes, there are 4 special things that you need to take special care and be aware of. And they are, first of all, your heart health. Remember that cardiovascular conditions are what cause most of the problems for those with diabetes. So be aware of what your cardiac risk factors are. Prevent them where possible, and control them if you already have them. Second is your kidney function. This needs to be checked at least twice a year and can be done by a simple urine test because, as you know, diabetes commonly affects the kidneys. Third is your eyes. Get an eye exam at least once a year to check for damage due to diabetes. Fourth is your feet. Protect them. Avoid calluses, injuries, and ill-fitting shoes because poor circulation and poor nerve sensation from diabetes can make it all worse. Equipped with proper knowledge, a proactive attitude, and proper lifestyle habits, you can be a winner when it comes to dealing with your diabetes.
You know, we talked about preventing diabetes, but what about, is there actual evidence that type 2 diabetes could be turned around, could be disarmed, maybe even reversed? Let me take you on a tour to 7 research centers that have dealt with that very question. Here's evidence number 1. Let me take you all the way back to 1933 to Montreal, Canada, where Dr. Israel Rabinovich instructed 100 insulin-using diabetics to eat a very low-fat diet. You know, that diet contained only 20% of the calories in fat, which is about half what we eat nowadays. And he found that within weeks, 24 of his 100 patients were off the insulin injections and their blood sugars had normalized. It was an incredible early finding, isn't it? And then evidence number 2, only a year later, a very distinguished English physician by the name of Sir Harold Himsworth was able to show in many controlled experiments that the more fat in the diet, the lower the patient's sensitivity to insulin. That is to say that the higher the dietary fat, the lower the insulin's ability of moving glucose from the bloodstream into the cells. He found that the blood sugar levels changed in response to the amount of fat in the diet. And here is evidence number 3, 1955. A physician by the name of Inder Singh is trying to see if he could confirm the work done in the early years in Montreal and London. And so he took 80 insulin-using diabetics and he prescribed them a simple 11% fat diet. You know, 11%, that's even much less than what's used before. And of course, he combines that with natural foods. So with lots of beans, lentils, whole grains, and fruits and vegetables. And here are his results. Within 6 weeks, 50 of his 80 patients were off insulin, and another 18 were off insulin in 18 weeks. You know what that is? That's a success rate of 85%, and that in weeks. Good news, isn't it? Evidence number 4, this time Australia. Here, Dr. Karen O'Day took 10 Aboriginal people who had become urbanized and diabetics and placed them for 7 weeks once more into their more traditional Australian outback to live as hunter-gatherers. With their calories this time coming largely from roots and berries and wild animals, their diet now averaged 1,200 calories a day, and of these, only 13% came from fat. In the process, they lost 18 pounds, which is about 8 kilos, and their average diabetic blood sugars of 209, which is 11.6, dropped to non-diabetic levels of 119 or 6.6 without having to rely on any medication. And how did they accomplish this in just 7 weeks? Here, by following a simple, less refined, more traditional diet with little fat and lots of fiber. Now there's evidence number 5. More recent data from the Predicate Longevity Center showed that when they took 864 diabetics and gave them a high fiber diet, very low in fat and cholesterol, consisting largely of, would you guess it? They took fruits and vegetables and whole grains and beans, plus daily walking, and at the end of their 4-week residential lifestyle program, 76% of these type 2 diabetics were off their oral drugs, and 44% were off their insulin. And that's in 4 weeks. Amazing, isn't it? Now, evidence number 6 takes us to Professor James Anderson at the University of Kentucky. On the basis of more than 100 published reports and scientific articles, Dr. Anderson asserted with much eloquence again and again his conviction that many type 2 diabetics could be off the medications if they followed a simpler whole foods diet. For instance, in metabolic ward studies, he took a total of 28 diabetics who were using 14 to 32 units of insulin and placed them on a whole foods diet, simpler foods, plant-based, very low in fat, less than 10%, and high in unrefined carbohydrates and fiber. And here's what happened. Within less than 3 weeks, 22 were off their insulin, and the remaining 6 diabetics had their insulin reduced from 28 to 14 units in the same time period. Now that is a breakthrough. Based on his extensive work then, with using high fiber and simple whole food diets in the treatment of type 2 diabetics, he summarized his presentation at the annual Public Health Convention at Lehman University, California, by stating, with great confidence, he said, 50 to 75% of diabetics on insulin and 80 to 90% of those on pills could normalize their blood sugars and be off medication within weeks if they changed the diet. A true breakthrough. And here's our last piece of evidence, evidence number 7. Let me introduce you to Dr. Neil Barnard, a physician, also founder and president of the Physicians Committee for Responsive Medicine. He showed in several studies funded by the National Institutes of Health that type 2 diabetes indeed responded exceedingly well to a diet very low in fat, but high in fiber, and consisting again of, you guessed it, didn't you? Yeah, fruits and vegetables, whole grains, and legumes, which was making medication no longer necessary in the majority of his diabetic patients. Perhaps it's time for us to change the rules. Perhaps we need some new rules for the game of beating diabetes. And that is, perhaps fats and refined foods and animal products are out, and whole foods with a rich fiber and nutrient content are in. Maybe we ought to couple that with a daily walk and with close supervision by your physician. Because as you move forward with the CHIP program, you will find that your physician may need to reduce your medication and that your new lifestyle is now becoming your new therapeutic friend with proven results and priceless benefits.
Now, clearly, diet is incredibly important when it comes to diabetes. And the optimal diet is ideal because plant-based whole foods are broken down slowly, so it makes it easier to manage blood sugar levels. And as we've learned, the optimal diet can even help with the underlying causes of diabetes, which means that it can even help with its reversal. And so the takeaway message is that if you're a diabetic, you don't need some special variation of the optimal diet. It's ideal for you just the way it is, just as it is for everyone else. But while diet is incredibly important for the prevention and the management of diabetes, I can't stress enough that so too is physical activity. In fact, the American Diabetes Association say that physical activity is a cornerstone of diabetes care. And one of the reasons for this is that exercise actually helps improve the effectiveness of insulin within our body. And insulin is very involved in blood sugar level control. How's this? Just one single bout of aerobic exercise can increase the effectiveness of insulin within our bodies for up to 3 days. How's that? And so this is why peak bodies recommend that diabetics shouldn't go more than about 2 days without doing anything aerobically active. Of course, every day is the ideal. But what I also want to say is that we're discovering it's not just aerobic activities that are great for diabetics, it's also resistance exercises. And here I'm talking about exercises that you might use light weights or even just your body weight to perform exercises that work and tone the muscles a little. What we've discovered is that, and this has especially come out from researchers from the Baker International Diabetes Institute, they've discovered is that through regular resistance training, you can actually get the same benefits in terms of blood sugar level control as drug therapies. And for this reason, we actually recommend that diabetics should be involved in resistance training programs at least 2, or ideally 3 times each week. And of course, exercise does more than just help with our blood sugar level control. It also keeps other parts of our bodies healthy as well. And this is really important when it comes to diabetes. For example, it improves heart health. And we know that diabetics are more prone to heart disease. But it also increases your muscle strength and your bone strength, improves your mood, and just makes you all round more functional. And so the takeaway message is essentially that when it comes to diabetes, you can't go past the 2 basics when it comes to best care. That is food and fitness.
So we saw there the review of 7 different studies, or some research, published research that he cited. And I don't want to overload you, but I want to show you a couple that have come. Oops, I need to turn my mic on. Sorry for that. Yeah, so he reviewed 7 studies, and I don't want to overload you, but I do want to show you a couple that I think are very, very relevant that have come since that lecture from Dr. Deal and Dr. Morton as well. Okay, let me go here. This part I've already covered for you, those slides I bypassed. I want to, so I'm going to pick a few slides out of this study. This is way too many slides in here for us to cover all in one time. But notice this, this was published in 2011, and the title of the commentary was Type 2 Diabetes, Remission in Just a Week. Now, some of the folks are reluctant. I mean, for decades, the American Diabetes Association website said literally, type 2 diabetes is incurable, irreversible, progressive, etc. And this was based on the interpretation of a couple of studies that were quite significant that showed that watching type 2 diabetics over a period of a decade or more, there wasn't any remission. There wasn't. It was incurable, irreversible. All you could do was help them take medications to control their blood sugars. but there was a piece missing that was unrecognized at that point, and that was they made no lifestyle changes. They were just watching people, progress, continue with their toxic lifestyles. And it wasn't until we began to put the facts together that we realized that blood sugars could be controlled without medication. But then the skeptics said, well, but wait a minute, you can't say that you are reversing the disease. All you're doing is controlling the blood sugar. You're keeping the blood sugars in a normal range. Okay, good. So these fellows did a study. The study was done in the United Kingdom. And I want to show you, this was a comment about that particular study. It says, we have learned that type 2 diabetes can be prevented by maintaining a healthy lifestyle. Well, we knew this quite some long time ago, that you could be prevented. But it says, such therapy is inexpensive and without side effects. Regarding patients with established type 2 diabetes, we often dream of a magic pill that would permanently solve the problem. We might perhaps view type 2 diabetes as a point of no return when we look at long-term data, such as those provided by the UK Prospective Diabetes Study, progressive deterioration of glycemic control and beta cell function, irrespective of therapy, be it pharmacological or non-pharmacological. So that's what I was saying. This was the study, the UK PDS was the study that led the diabetes experts to the conclusion it was incurable and progressive. However, there's a piece that they left out, which I mentioned, and that was that there were no lifestyle changes. I'm skipping ahead here. So here's the slide talking about the diabetes control and complications trial, which was also done showing that if you tried to control the blood sugars too tightly, it caused harm as well. So the idea was the best we can do is try to keep the blood sugar, the A1C under 7.0, and just teach people, as Dr. Avery did. Andrea Avery was the doctor on these videos. She was telling you how to be sure you take care of your feet and your eyes and check your kidneys and so on. Because what are we talking about? Those are very important pieces of living with diabetes. But what I'm wanting to bring to you, the thing that I'm bringing out is that the latest research is telling us you do not have to live with diabetes. The vast majority, not everyone. So far, I cannot say unequivocally that 100% of people that have type 2 diabetes can put it in remission, but 90-some% can. And so I want to show you about this. So here's the slide I want to use to start with. So the UK PDS, mentioned there in that first dot point, is the United Kingdom Prospective Diabetes Study. What it actually showed was that type 2 diabetes is progressive and irreversible, without lifestyle changes. But then what happened was that the gastric bypasses started being done for people with obesity, and many of them had diabetes. And interestingly enough, their diabetes went away. It went into remission. So obviously, the researchers realized, well, we missed something here, because, in fact, type 2 diabetes can be put in remission with surgery. It turns out, as my little parenthetical remark, that starvation also puts type 2 diabetes in remission. Not very popular approach, but it did prove that it is reversible. So then they did this study called the Counterpoint Study, okay? And what they did that was so important was they didn't just look at the blood sugar. They actually used imaging to look at the fatty liver and the fatty pancreas, and because that's where the real problem was. And so they showed that they could produce remission of get the fat out of the pancreas and out of the liver. So that's what I wanted to show you real quick, and then we'll stop and have our taste sample. So here's what you see is a chart. There's three things that they're looking at here in this slide. On the left-hand side, we have the fasting blood sugar, plasma glucose. And you can see on the x-axis, it goes from 0 to 8, or actually one more, it goes to 9. And you can see that in 1 week, the fasting glucose came into a normal or healthy range. But if we look over on the right-hand side, this is where they're looking at the triglycerol, or the fatty liver, okay? Hepatic triglycerol is a medical term for fatty liver. And what you see there is that line coming down. By the end of 8 weeks, that was largely resolved. No more fatty liver. Well, the same thing was happening in the pancreas. The pancreas, they didn't show the chart, but it's basically the same kind of thing. And so that's why this article, when they published it, said reversal of type 2 diabetes. The first time I could find in the research, 2011, first time I found a credible article published saying reversal. And so, but that was over a decade ago. So as you can imagine, they've done quite a bit more research since then. There's one more piece of this that I want to show you that they, again, in the same article, but it's compelling in what it reveals. So what they did was they had these type 2 diabetics that they were studying, and they had matched controls. So they had people of this similar gender and age and weight and so forth, the factors. And what we have is in the top left, so there's six line graphs here. In the top left is the controls baseline. And what you see is from 0 to 80, this is minutes after the meal. So 0 is when these individuals began eating their meal. And then what you see on the y-axis is basically the insulin response, okay? What does the pancreas do in the way of producing insulin? And you can see in the controls who do not have type 2 diabetes that let me see if I can get my pointer on the screen. So you can see that there's a little bump in the first few minutes. Within the first 8 or 10 minutes, there's a production of some insulin. Insulin drops a bit while the food begins to be digested. And then about the time the food is ready for absorption, you can see it puts a larger amount of insulin, all right? Now, the next one over in the middle of the top is the diabetic patients, the people with diabetes at the beginning, okay, of the study. So, and you can see there's almost nothing happening here in the pancreas, and then there's quite a reduced amount of insulin released when the food is absorbed. So what would be the difference? Just common sense. What's going to be the difference between the amount of glucose in the bloodstream over here versus over here where there's so much less insulin produced? Well, the blood sugar is going to be high where there's not enough insulin being produced to cause it to go into the cells. And because these individuals have insulin resistance, even if it did produce the same amount of insulin, it would still be high because it doesn't have the same effect that it does in people without the diabetes. But look what happened in 1 week. Okay, so this one here is 1 week. You can see that the bump at 60 minutes is quite a bit higher. There's starting to be a little bit here in the first few minutes. And by the end of 4 weeks, because here's 2, and then here, the middle at the bottom is 4 weeks. And you can see that it's got a considerable production at the beginning. There's a bump here. And what's interesting is the researchers pointed out, I've repeated the controls here, the amount of insulin produced after 4 weeks of this treatment in people with type 2 diabetes was greater than the amount of insulin produced in the controls over here. This one and this one are the same, okay? Top left and bottom right are the same, just repeated so we can look at it. And it makes sense that would happen because the type 2 diabetics had insulin resistance, and so they were having to produce more insulin to get the same effect that you would get from less insulin in someone without diabetes. Okay? We already talked about the diabetes prevention trial. Dr. Deal talked about that in his presentation. I won't go there. I want to show you, however, this direct trial. So the direct trial was published, you can see in Lancet here at the bottom, February of 2018. There's a whole lot of words there. I apologize for all the words. Let me just tell you the bottom line. So they took about 3,000, no, it was almost 6,000. Anyway, they took on 49 primary care practices, and they randomly assigned these 49 group practices to either use the standard care for type 2 diabetes or to use the dietary approach that I showed you in the study by Lim that was showing reversal of the type 2 diabetes within a week or 8 weeks in the case of the triacylglycerol. So they put these type 2 diabetics on this program, and the outcome, I want to show you the pictures worth 1,000 words. Here's what happened. You can see on the left-hand side the bar that says all. This is all of the people who were put on this intervention for their type 2 diabetes, which was a very low energy diet that brought them down to a weight loss of about 30 pounds. That's what they're aiming for. The goal was 30 pounds of weight loss. And then once they had achieved that, they transitioned them to a regular diet. So they were not using the meal substitute, okay? But it was a diet that was high in nutrition and low in calories so that they could maintain their weight. And at the end of 1 year, 46% of all the people receiving this treatment had remission of their type 2 diabetes. And then when they stratified the group by the amount of weight loss, and that's what the bars are over on the right. So these are in kilograms, so less than 5 kilograms, that would be less than about 10 pounds or 11 pounds. And so those who lost, see the zero, those who lost no weight, no one had remission. Those who lost the 5 kilograms, or I'm sorry, under 5 kilograms from 0 to 4.9 or whatever, 7% of those had remission. Notice over on the far right, those who achieved the goal of 15 kilograms, about 33 pounds or more, had 86% had a remission of type 2 diabetes. Now, what's so significant about this is that's a little higher than the rate we see when they get gastric bypass surgery. So and this has been very interesting dialogue in the scientific community, in the medical community, because we're now realizing that actually the gastric bypass is not doing something magical with the hormones. It's basically reducing the amount of caloric intake and causing weight loss. So, well, there's so much more that could be said, but we're out of time. This isn't the last time we'll have something to say about diabetes during the health presentations. So I want to thank you for your interest and time. And who can tell us what we're doing with samples tonight? Do we have some?
So I'm not sure what we have for samples tonight, because I was in here when they got them together, but they'll be in the same place just to the left as you walk out. And we'll have to go find out what they're at.
All right.
And I think the next time we're meeting is next Tuesday, right?
Yes, thank you for that. The Bible prophecy seminars continue right on through.
Yes.
But we're not going to have another health presentation until Tuesday evening at 6 o'clock.
Correct.
And so shall we have a blessing before the samples? Let's just ask God's blessing. Father, thank you for the privilege of learning more and more about health and how our dietary choices can actually do so much, not only make us healthy and feel good, but also help to reverse our diseases. I ask your blessing on them tonight, in Christ's name.